My professional training is that I'm a medical anthropologist. That's okay. Thank you for coming. So I'm a medical anthropologist, and a medical anthropologist is someone who examines health and well-being through the lens of culture. I've taught at various universities. I'm currently working at CDU. I teach one unit in the Masters of Midwifery, and I'm a midwife and a nurse myself, as I've just said before. All my career, I've really specialised in sexual and reproductive health. And as a midwife, I've delivered babies. I worked as a clinical nurse. I've been the director of family planning for on the board, so the chairperson of family planning for a decade, and I worked with them. So I kind of thought I knew a lot about sex, reproductive health, and I think what really shocked me was that only relatively recently I understood the anatomy of the clitoris. And I always find these kind of moments kind of humbling when you don't know something. You realise you don't know something very well. And of course, for me, as an academic, I immediately want to go in and explore, why don't I know that? What does that mean? Why was that knowledge withheld from me, I suppose? So that's kind of what I'm going to take you through in this next section. I've won a grant, and I've kind of put this logo up, and this is one of the things I feel a bit chuffed about. There's very little that our government does on sexual and reproductive health. Everything is quite grudging, and it feels like it's a bare minimum. And I mean all flavours of Australian governments. I don't mean necessarily just the current one. So to win a grant from the government where they pay me to do some of this work has been really good. And I'll tell you more about what I'm doing with that money as well. And now it's not advancing. Let me see if I can get it to do it. Here we go. So this is what we're going to go through. Welcome, relax. I'm not going to ask you any personal questions. So, please don't feel I'm going to put you on the spot and ask you about your clitoris or what you know. I've told you a little bit about me. I'm going to take you through the case of what I call the missing clitoris. Let's face it, it's often missing, and I'm going to tell you about my company, which is called Anatomical Education. So really what I'm talking about is health literacy. There's a concept in health teaching and health education called health literacy, which is why I do actions under the word of cliteracy. So I'm spoofing on that kind of word game. Health literacy is simply the idea that if we know about how our bodies work, it will assist us to have better health and well-being. So I'm not suggesting that I can teach any of you new tricks. You've all probably had sex, you've had good sex, you've had bad sex. Some of you are good lovers, some of you have got more things to learn. So I believe that sex education is very important for us. It's very important for young people and everyone. It's particularly important from the idea of women's pleasure. So obviously in this session I'm focusing on women's pleasure. Now, the most common problems that women face are around low libido, lack of desire, difficulty having orgasms, not experience sexual pleasure during sex, or even worse, having painful sex. And they are really unfortunately, they're really quite common. This orgasm gap is what I want to talk about. This is something that someone said yesterday, what's the orgasm gap? And I kind of thought it was a bit like the pay gap, that everyone kind of understood it, but clearly not. So I'm talking about this discrepancy, and I'm talking about the discrepancy between men and women, with men's relatively ease to orgasm in many sorts of situations, and women's often difficulty to have orgasm in many situations. And this actually plays out even for lesbian women. Because, there's something in my head that says, well, if a woman and a woman got together, wouldn't they just intuitively understand how to turn each other on and pleasure each other? But apparently not. So this is kind of what I'm addressing. This possibly the elephant in the room is the orgasm gap, and thinking about that. So I want to show you right from the kind of cut to the chase, show you a normal clitoris. Now, some of you were here yesterday, and I know this is already old hat for some of you. You know it, you've learnt it in other places. But what I find when I go out and talk is nearly half to a third of people in the room, this is men and women, have no idea that is the normal clitoris, that pink pink thing. And you can see that is a 1-to-1 scale model. And that is what I've started to explore, and I've designed an anatomical model. I've got it manufactured and we're actually selling them now. We're selling them around the world. So for a start, it's not a button. The clitoris is an organ of sexual pleasure. It creates orgasms when it's stimulated. And this doesn't mean that other parts of your body or emotions and thoughts are not important to sexual pleasure. Of course they are. The biggest organ is this one, isn't it? It's your brain and what you think about what's going on. But just sticking to the anatomical bit at the minute. Skin, you're right. Skin, brain, you're correct. The glans is very sensitive at the top of the vulva and the inner lips. The clitoris shaft is about 1 to 2 centimetres long, and when stimulated by stroking, pressure, licking, vibration, warmth, these all create good feelings. The clitoris complex, and I'll use that word a lot. When I talk about the clitoris, I'm not just talking about the little glans bit on the end, I'm talking about that whole body, and I'll explain those bits to you as we go on. The clitoris complex swells and it ripens when you are aroused. Most of the clitoris is internal and it hugs the vagina and the urethra, the tube that you pee through. The clitoral complex is made up of the glans, the shaft, 2 bulbs and 2 crew, and it's attached to the pubic bone. We learnt that yesterday with Clee when she came in, the physiotherapist talked about this. Here's one of those, not too overly medical, maybe it is medical, but this is what the nicest picture that I could find of a clitoris. It's the one I'm kind of going with at the moment. So it's about 9 centimetres by 9 centimetres big in an adult woman, and it gets bigger after menopause. And the nerves that actually connect the clitoris to the spinal cord are large. They're larger than penile nerves. Orgasms, as you know, are explosive, enjoyable reflex pulsations that are felt deep in the pelvis, the vagina and the anus, and all of the erogenous zones. It is a whole body experience, not necessarily limited to one part of the body. The vagina does not have the same nerve endings as the clitoris. As the clitoris hugs the vagina, or any vaginal touching will arouse the internal parts of the clitoris and the bulbs. So I'm just going to show you some more pictures. This is obviously a 3D rep. So this is the front of the body, the front of the woman's body. This is the back of her body. The white bits are the bones, hip bones. And what you can see here is this is kind of like the pelvic floor that Clea was talking about yesterday. And the yellow bit is the clitoris, and it's not just that little bit at the front that we all know at the top of the labia. It actually slings around the bladder. It slings around the front and the back of the vagina. So that's why the vagina feels good. And when people talk about the G-spot, which is if you went in, I'm going to talk about G-spot as bullshit. It doesn't exist, but you're feeling the clitoris. You're actually feeling the clitoral complex when you go in there, okay? Is that new, interesting information for some people? I'm seeing eyebrows go, which usually means, oh, that's interesting. And I'm like, I'm glad.
Yeah, particularly what you were saying about the G-spot, it seems to be a topic of conversation in women's magazines. But it's interesting to know that from your point of view that it doesn't exist, it's just part of the stimulation of the clitoris.
Correct, and I will talk a bit more about that. Okay, clip facts. Let's take a look at some clip facts. Well, clearly it's much bigger than most of us ever thought. In fact, the clitoris is rather like an iceberg where the tip is visible as the glans and the larger clitoral complex is internal. There are more than 8,000 nerve endings in the clitoris, and in fact that's double than the kind of go to a penis, would you believe, which can sometimes explain why women that the glans is so sensitive. You know, when she goes, stop doing that. Sometimes it's to do with that. The clitoris is the only known body part with the sole purpose of pleasure. It doesn't do anything else. That's what it's for. Research tells us that 50 to 75% of women need to directly touch or stimulate their clitoris to be able to orgasm. The clitoris really is where the main action is. The clitoris swells during arousal and it becomes engorged and enlarges. And some of us went searching for our G-spots in round about the 1980s when Adagio and Whipple, Beverly Whipple, who was a research nurse, and it was a fabled area inside the vagina where if you touched it, it left women in paroxysms of pleasure. It was supposedly a fleshy, highly sensitive area in the front wall of the vagina, but the G-spot never existed, except for in porn, where it lives on and on and on, and some quasi-scientific writing. The clitoris, I think, is really beautiful and it is purpose-built. It is the only organ in the body that is the sole purpose is pleasure. Orgasms, as we learnt yesterday, are good for your health and well-being. Orgasms originate in the clitoris and are relaxing and release the happy hormone called oxytocin. So one revelation in understanding the clitoris is that penile penetration is not necessary for clitoral stimulation and orgasm, although clearly it can do that. And another is that it's difficult to actually miss the clitoris, as it's both outside and inside a woman's body, which I think is good news for most men or lovers of women. So let's see, I'm going to talk to you about the missing clitoris, and this is where I went on my kind of medical anthropology kind of journey of like, how come we weren't taught that? Like, why is it that so many of us don't really know that? So I'm going to talk you through FGM. So when I say FGM, I'm talking about female genital mutilation. It involves the partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. This practice has no health benefits for girls or women. FGM can cause severe bleeding, problems with urinating, infections, as well as complications in childbirth. And around the world, something like 2 million women are cut in 30 countries around the world, Africa, the Middle East, and Asia. It is an illegal practice in Australia, and if you ever get a whiff that that is happening in your neighbourhood, you need to report it to protect the girls. FGM is mostly carried out on young girls when they are infants and up to around about the age of 15. It is considered a violation of human rights of girls and women, and the World Health Organization and many, many other grassroots organisations across the world are working to eliminate the practice. And I think we'd all agree that it is really totally unacceptable to cut women's genitals off. But why is this done? The practice is carried out mostly by traditional circumcisers who often play other roles in their communities, such as working as traditional midwives. FGM is a manifestation of inequality between the sexes, and it constitutes really an extreme form of discrimination against women. It is nearly always carried out on minors, and it's a violation of the rights of children. FGM is often considered a necessary part of raising a girl and a way to prepare her for adulthood and marriage specifically. FGM is often motivated by beliefs about what is considered acceptable sexual behaviour, and it aims to ensure premarital virginity and marital fidelity. In many communities, it is believed to reduce a woman's libido, and therefore believed to help her resist extramarital affairs. It is done to increase social conformity, to maintain sexual stereotypes, to oppress women, and to increase the likelihood that women will be marriageable and acceptable to men. It is associated with the cultural ideas of femininity and modesty, which include notions that girls are unclean and beautiful after removal of body parts that are considered unclean, unfeminine, or male. The clitoris is considered male, and sexual desire is considered male in many cultures. Though no religious scripts prescribed the practice, practitioners often believe that this practice has religious support. Religious leaders actually, in reality, take varying positions about FGM. Some do promote it, some consider it irrelevant, and others actually work actively to try and eliminate it around the world. It is often considered a cultural tradition that is deeply embedded, which is a deeply embedded belief in a culture about what is right and wrong. And when you sit inside a culture, it is often quite difficult to take yourself out of that culture and look at it from a distance. But really, what's this got to do with us? We don't live in Africa, and we don't cut off women's genitals in Australia, do we? Do we? But what if I told you that most medical, nursing and midwifery textbooks do not depict the clitoris? My medical friends started to talk with me about the absence of the clitoris in their medical training and textbooks, and I'd also noted the same phenomena in my own nursing and midwifery and family planning training, that I'd never been taught the anatomy of the clitoris, not very much about sexual pleasure either, to think of it. And I asked some of my adult postgraduate students who were health professionals, and many of whom were teaching themselves, for examples of the textbooks that they were using. And I asked them to send me some pictures that described pelvic anatomy, female pelvic anatomy. And these are what they sent me. These are current textbooks, and they're very typical. This picture shows you a picture of a female body lying down. So it's on the full frontal. Like if we're using a porn scenario, it's a full frontal. It's lying down. The woman is on her back, and her legs are open. There's no pubic hair. That's odd, right? Because normally adult women have pubic hair. There doesn't really appear to be any large lips or labia majora. The little lips, or the labia minora, are symmetrical and they're small. The vagina is gaping open. And the vaginal wall inside is visible. So not this one, because this one is the one where she's chopped in half. Sorry, it sounds crude, but in anatomy we chop, we kind of chop and slice and dice. So this one is the full frontal. If you look at this lady's vagina, I've been a midwife for many years. Vaginas only look like that directly after delivery of a 4-kilo baby. But, okay, they do gape a little bit after that, you can imagine. But within a week or 2 weeks, I'm telling you, they snap back. This is really weird. If you ever see a picture of a vagina and you can actually see inside the vagina, something is desperately wrong with that lady, right? She's probably got a bit of a prolapse problem. Our vaginas are just closed. They're not waiting to be filled by anything in particular. And in this one, it does say there's a clitoris and happy days, but you can see there's, it's a bit vague, and if you skipped over it, you might just think, oh, that's a bit of a muscle. It doesn't actually show you, remember that kind of penguin orchid kind of figure? If you only take what's called a sagittal or a transverse section, which is all you get in anatomy textbooks, you will never know about that how the hug, I like to call it the hug around the vagina and the urethra happens. So what I think is, this is not a normal vagina. If I saw a woman like this, I think she's maybe 12 years old and she's had something flappy done to her vagina. It is not a normal vulva. It is stylized and almost childlike. The clitoris is depicted, I think I've said all of this, blah, 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 blah. If you actually read some of the text, which some of you have done already, it talks about it being small, 2 centimetres in length. It's kind of misleading. And often the other thing that textbooks tend to do is they make the comparison. They directly go to the penis and compare it with the penis, as though that was the standard model and that the clitoris is kind of a deviation, an abnormality, something different. So if you want to see a normal vulva, not vagina, I suggest you go to the labia library. I don't know if I've got a little picture of that. Let me see. It's a fantastic collection of a huge variety of vulvas that women have. This is important because I've seen patients who tell me that they're not normal. This is one of the number one concerns of all women that I've ever met in clinic is, can you just tell me if I'm normal? I don't think I'm normal down there. And you think, oh, okay, maybe she's not. Let me do you might be doing a pap smear or something like that, or feeding her with some contraception, and you have a look and you think, It's normal, it's completely normal. And so you spend an awful lot of time reassuring young women, particularly, but older women too, that they are entirely normal. And also I've had doctors send women to me who said they're not normal, and I don't know, again, I think, oh, these poor doctors must be learning from these textbooks, right? Or looking at a lot of porn. I don't know what they're doing, but you're normal. So since 2001, there's been a rise in the number of Australian women who believe that they are not normal. And I can tell you that doctors make a profit for this. Here we go. Here's some diversity for you. This is diversity and inclusion. This is true diversity and inclusion. So when you look at somebody's face and you think, gosh, look at her face. She's blonde hair, curly hair, long face, a bit lopsided. She's got blue eyes, grey eyes. Guess what? Women's fannies do exactly the same thing. They all are quite different and they all are completely normal. But you don't see that in porn, do you? No, you're not confessing to. You don't have to confess to looking at porn. But you don't. I'm telling you, I've looked at porn and it doesn't look like that. So there are doctors who like to make a profit from vulnerable patients. Female genital cosmetic surgery involves or something sometimes called labiaplasty. And what it does is it cuts the edges of the inner lips so that they do not extend beyond the outer skin folds, the labia majora. It can also extend to procedures like vaginoplasty to tighten the vagina, hymen repairs if you need to get your virginity back, whatever that is, and vulval lipoplasty to remove fat from around the vulva. These are all real things that are offered by cosmetic surgeons and gynecologists to Australian women today. An article from the Medical Journal of Australia, which analysed over 4,000 cases of labiaplasty, or cosmetic surgery to alter the size and shape of the vulval lips, found that women were more likely to have a caesarean section afterwards, later down the track, if they had this type of cosmetic surgery. And 1 in 14 of them experienced serious complications from the surgery. 1 in 14 in Australia. Think about that. According to the Royal Australian College of General Practitioners, this includes infection, wound rupturing, pain during intercourse, and reduced lubrication, the thing that all women want, right? Yet demand for the procedure is going up, and it is being widely marketed by commercial cosmetic clinics. So remember what I told you about FGM and how that was bad for women's health in Africa, and we can all kind of wag our finger about that. Just look at some of this. Does that all make sense to you? Are you all used to looking at graphs like this and it makes sense? It's all, yeah, good. So let's go into history. So that's kind of current day stuff in Australia. History. Science and medicine were not always unaware of the clitoris, and it has been rediscovered several times over the centuries. Now, women won't be surprised about this, but men love discovering and writing about the clitoris. In ancient history, the Greeks did not dissect bodies. They used animals, and then they used their own philosophy to guess anatomy and function. They believed that women were inferior to men, and women were men who were inside out. Thus, the vagina was an inverted penis. I mean, it's a lovely logical thought, of course, but it could also be that the men were inside out, but it didn't work that way, if you know what I mean. In the 15th century, the Malleus Maleficarum was a manual to find and interrogate witches, and it describes the clitoris as one of the markers of a witch. In the 16th century, the first human dissection started to take place, much against the will of the Roman Catholic Church at the time. These dissections observed that the clitoris existed, and authors such as Ronaldus Columbus described the clitoris really, really well. And midwives also started to have textbooks in the 17th century. And one midwife called Jane Sharp, she described its function, saying, "The clitoris will stand and fall as the yard doth, and makes women lustful and delight in copulation." She called the clitoris the female penis. Rainier de Graaf in 1672 also wrote about the clitoris. More recently, in 1844, George Ludwig Kolbelt wrote a very detailed and good description of the anatomy of the clitoris. But around the turn of the century, Sigmund Freud, the father of psychiatry, talked about women's sexual response in a way that has not been good for women. Oop. He described two types of orgasms. The clitoral orgasm, which he said was immature and childlike, and the vaginal orgasm, which apparently was mature and what normal, healthy women did. These two types of orgasms, the clitoral and the vaginal, are strong myths in the female sexual response. Women are not just body parts, they are complete women, and orgasms are mediated through the clitoris via the vagina. By 1901, Gray's Anatomy included the clitoris, yet it was absent in the 1948 edition, and it failed to be included for many, many years. So that's nearly 50 years of not teaching about the clitoris. Such deletions occur largely due to concerns about social hygiene and morality, nothing about science. This continues in various ways today, in that it is excluded or only superficially presented in standard teaching curricula or textbooks. And this has led me to consider the ramifications for teaching and training of health professionals. Now that you know the truth, you can see why the clitoris is overlooked and presented as though it was small and inconsequential to women's sexual pleasure. You also understand that the health professionals that you're visiting, their knowledge actually might only be quite rudimentary. You can see where this is going, can't you, ladies and gentlemen? Okay, language. Let's now turn to language. Language is the way that we express ideas, share beliefs, and one of the ways we communicate with our lovers. Consider all the words that you know for penis. Now consider all the words you know for clitoris. So this is a bit where I'm going to ask you for a bit of audience participation, because you're all grown-ups, it's an 18-plus thing. I want you to think of all the words that you know for the word penis. You just shout them out.
Dick.
Thank you. Dick.
Woody.
Woody.
Schlong.
Schlong. I love that one. Schlong. Sounds good. Schlong. Get your schlong on.
Cock. Junk.
Junk.
Cock.
Cock. Of course, cock. Prick. There must be more.
Willie.
Really throbbing member.
Frank.
Meat stick.
Frank.
Frank. I did say. No, of course you'd never use that word. Yes, and let's do the same for clitoris.
Box.
Oh, hang on. This is where I get to learn stuff. Fox.
Box.
Oh, box. Box. That's clitoris, or does that mean vagina?
I'll play vagina.
Yeah. Sorry, I thought you said fox. I was like, oh, that's cool. No, the clitoris. The word, the other words for the clitoris.
Button.
Thank you. Good.
Switch.
Switch. Beautiful.
Just clip.
Clit.
Yeah.
Clit.
P, as in gun, P. It's about the
P.
same.
P.
Yeah.
So, yes. P as in PEA. P. Beautiful.
Many, is it?
Well, thank you for saying that. Because you do, yeah. And again, this is it's a nice little exercise, isn't it, around vocabulary and things like that. We have an awful lot of vocabulary for penis, and not so much about the clitoris. Why would that be?
Do you think for the clitoris, though, it's a part, people think it's more of a part of the vagina, so if they were to compare, they would compare vagina and penis, not penis and clitoris. So I think that's why it's not, I think in my generation anyway, it's not so much discussed, so much the clitoris, it's the vagina itself.
Why would that be, though? If I've just
Because
told
of
you
the
that...
lack of education. And I think the aspect that people don't so say break down the anatomy of the vagina, they just assume it's one.
But if I said, like now you know what the clitoris is, like the main game.
Yeah.
You see where I'm pardon?
We don't want girls having too much fun.
Well,
on behalf of the patriarch, not necessarily.
We do. Well, yep, you're right. And then, of course, the other root, which none of you said, is the cunt word, and it isn't a word for the. I'm not suggesting cunt is the word for clitoris, but we didn't actually talk about some of the nasty kind of words, gash, slash, cunt, which again, not words for clitoris, but for female genitalia. And those are words that, what, you know, they're derogatory, they sound kind of nasty, they are a bit demeaning, aren't they? You can use these words, and we know these words, but it's like the vocabulary that women have for their genitalia. It's either childlike, you know, my pee-pee, my Mary, my twat, you know, it's kind of either childlike or it's really nasty language, or you've got the very clinical medical language, which, you know, it's using medical language in a love situation kind of feels a bit weird, because, you know, like, are you going to see a fucking gynecologist, or are you having sex with your lover? You know, you kind of. So that's now. Let me just see if I have covered what I wanted to tell you and not going off tangent. I can really easily go off tangent. Yeah. So this is the point that we're coming to, is that only women's genitals are more often considered a slur. It's a slur, but they're also more often considered shameful, smelly, and dirty. So how does this lack of clit language, that is usually negative and pejorative, impact on women's sexual pleasure and intimacy, and about the discourse that you can actually have about desire, female desire, when you're left with a very limited and negative language? And the men in the room may have noticed, the heterosexual men in the room might notice this, that it can be quite difficult for women to actually verbalise what they want, where they want it, and why it might feel good. This is some way to explaining that. So in Australia, FGM is not, it's actually, what I'm suggesting is it's performed more subtly. We don't cut women's clitorises off when they're babies or when they're little girls. We do it by not representing the clitoris, by not teaching sexual pleasure, and by the lack of vocabulary. We do it in a more subtle way. This has implications for sexual behaviour like masturbation and sex toys, which are often represented from the male's perspective. Oh, here we go. This is the exercise you've done. I don't know if you didn't get all of them. I've brainstormed this a little bit more before. There was some classic, Schwanz. Ich liebe deinen Schwanz. Trousersnake. Lingam. Lingam is actually it's a beautiful word in Hindu language that is about, you know, revering the fertility of the penis. Plonker, sausage, John Thomas, pee-pee, love stick, blah blah. I need some Aboriginal men to teach me their words too, but I probably won't have the courage to ask them. I'll get somebody else to do that for me. So here we go, on to vibrators. So this has implications for sexual behaviour like masturbation and sex toys, which are often represented from the male's perspective, which they're often penetrating, they're large, they have lots of buttons and bits on them. There's actually very little research on how women prefer to masturbate, but we do know that it improves mood, it relieves menstrual pains, and it is associated with positive genital self-image. In the most comprehensive study of American women's vibrator use to date, researchers found that, let me get this right for you, 52, so half of the women used vibrators, and 46% of them used them during masturbation. Many also used them with partnered sex. Vibrator users described greater likelihood of engaging in other healthy behaviours, like getting regular gynecological exams, performing genital self-examination during the previous month, and a vibrator use also correlated with increased sexual desire, arousal, lubrication, orgasm, absence of sexual pain, which is a really important one, and overall sexual functioning, which I think is like they're often sold as just for the, I don't know, but this is really a good news story, I think, about the use of vibrators. Liberal sexual values and more sexual knowledge correlated with more frequent masturbation. So if you're smart, you masturbate. It's amazing. In research, women speak of not having to perform sexual labour. This is during masturbation. So they don't have to be bothered about moaning, groaning, or mutual pleasure. It's a very self-indulgent thing that you can do. Self-pleasurable thing. Masturbation is simply, according to the women in this research, it's for stress relief and personal relaxation and for sleep. So young women are doing a great job. I want to show you some young women doing some awesome stuff. This is a beautiful woman. I don't know if you've ever met her at a festival. This is Ali Sebastian Wolf, and she is a performance artist, and she has an enormous golden glittering clitoris that she takes off to festivals, and she says it generates amazing conversations, largely about what is it, oh my God, why did nobody tell me, and look how huge it is. So that's kind of it about the research that I've done so far. I want to tell you a little bit about this lady who actually she rediscovered the clitoris again and put it into medical science. So there's a lot of rubbish written about orgasms and clitorises. I think that's what I want to say. But this is not one of them. So what Helen's story is that she's a medical doctor, which you can see, and she was the first urologist in Australia. And urology is an area that deals with prostate cancer, bladder problems, incontinence, that type of thing. And it because of the history and patriarchy, largely men go into these specialities, and it's a very man-focused discipline as well. So here she is, lady doctor, decides to be a urologist. Whoa, that's really different. So she goes through all of her urology training. So you have to be a surgeon. You're learning to be a surgeon. She looked at all the textbooks and she saw the same thing that I did of like, oh my God. And she noticed that with prostate surgery, if you have prostate cancer, one of the things that the urologist will do for men, when they take the prostate out that is diseased, they're very careful about, it's called nerve sparing surgery, sparing the nerves that supply the penis, which are nerves for sensation, but also action, right, that make things, they do that. So surgeons were very good at sparing nerves. What she noticed for female pelvic surgery was no nerve sparing.
Gotcha.
Can you imagine? And she was shocked. Butchery, essentially. She was shocked. So she went off and decided to do her PhD. She's clearly overeducated and, one of these kind of women that's just, my God, going for broke. She did her PhD. She approached her professor and she said, I want to dissect the clitoris. I feel there's more there, more going on. I need to understand the nerve pathways, because she was cutting and operating in that area. She did her PhD. I think I've got the dates up there. I might have the dates. I'm not sure if this comes next. No. She worked on this from about 1998, and she has published in scientific journals, which you can access. If anyone wants them, I can give them to you. And they're very technical descriptions of the dissections that she did. Thank you. I've got about 10 minutes to go. She dissected 12 women's bodies. That women were dead. They donated their bodies to science, and she described the clitoris. And so what I do is I work with her to develop the model, because very few people read peer-reviewed scientific literature. It's dry, it's locked away behind paywalls in universities. No one reads this stuff. So when I started to work with her, I was like, okay, Helen, how can we get this information out? And she's busy operating on people. She doesn't want to do this stuff. So that's why we designed the model. So the models I'm selling are anatomically correct. They're a 1-to-1 scale, and she's gone tick of approval. She's given us that approval. We've won grants, which I'm really thrilled about, and we've kind of got the tick of approval from government as well, NT government. It's been great. And also for women working in STEM who are going, because I work with 3D artists, I work with anatomists, and I'm also working with artists. So I'm trying to go across a cross-disciplinary way. So my business is around educating and health literacy, mainly for health professionals, to be honest. I haven't kind of thought about doing it for lay people. I'm not sure that I don't know yet about that, but certainly for health professionals. So this is our company. We want to reduce the orgasm gap, increase the pleasure spectrum for everybody. We'd like to bust myths. If you've got myths in your head or things that you haven't been taught right, just busting those myths. Teach, and also you can order stuff. So if you're a health professional or a therapist and you'd like to have a model, it's not a sex toy. You don't put it in your body or on your body or anything like that. It's literally to demonstrate and to teach. You can do that. So that's my company. This is stuff around self-knowledge. I'm happy to give anything out to you. We call our model Betty, after Betty Dodson. Betty Dodson died in 2000. She was amazing, one of those 70s feminists who went out and taught women about their own bodies. So they back in the day when you'd sit around and take your clothes off and stare at each other's cervix and masturbate together. I don't know. Maybe in Byron Bay, there's a few places like that you might do it. Maybe not in Darwin. I don't know. Just saying. But so we call Betty D. So here are some things that I've read or can recommend. I think one costs not very much, and a lot of it is free information, free to you to look at. So I think my last points are coming up. This is the main message. If you can repeat this, I'm really happy that you've learned something. So it's not a button, it's an iceberg. And you can say that to people over a sexy cocktail, and then maybe you can explain it to them or even show them what you mean. So, the summary, I think you should love your clit. You should include it into your intimate conversations, and you might even have to make up your own language, because we have just, in English, their language isn't there yet. You can educate your lovers and friends, and I would say beware of the quacks and the pseudoscience, and I include doctors in that. There are cosmetic surgeons who would love to take your money to make you normal. And I would just say beware of those, get some more information before you do it, because it's not all beer and Skittles and fun. And I think there's a lot that we still don't know. I'm learning all the time, and the more I delve into it, I'm learning and learning, which is really good. This is just some of my contact. You're welcome to email me, engage me to speak elsewhere or teach. One of the things I've got coming up, which I'm really looking forward to in July, is I've got a show in the Fringe. As you can tell, I'm not much of a performer outside of the classroom. In the classroom, I'm okay, but on a stage, probably not so okay. I've partnered with a whole load of artists, and we're putting on an exhibition and we're showing a film. And again, it's sit in the audience. You don't have to self-disclose anything or tell anyone your gender or your sexual preference. This is just for fun and interest and art. So that will be a fun show. So please come along to that. Any questions? Anything I said that you didn't agree with, or you thought I was a bit, could have said slower or clearer? No. So you?
It's a lot of information.
It's a lot.
It's like, whoa.
Okay, maybe a book one day. That's it. Thank you very much for coming, and enjoy your clitoris, or somebody else's clitoris. Thank you.